Welcome to AP Leadership Podcast. I'm your host, Al Pylong, CEO of AP Leadership Partners, an executive coaching practice centered around a passion for effective leadership. There are two things I know for sure about leadership. First, leadership is hard. And second, leadership matters. And so my hope today is that through the course of this conversation, you will find fresh ideas and inspiration for your challenging but important leadership journey ahead. Thanks for listening. The AP Leadership Podcast is sponsored by CXO Coaching, an executive coaching firm focused on empowering leaders and driving results. And now, let's get started. In today's episode, we will be talking about inspiration and impact in life and leadership, as well as how we navigate transparency and vulnerability as leaders. And to do that, I'm pleased to welcome Mark Nantz, who is a visionary leader and community servant who currently serves as President and Chief Executive Officer of Valley Health System based in Winchester, Virginia. He also currently serves as the chair of VHHA, the Virginia Hospital and Healthcare Association Board. Mark, welcome to the episode. Welcome to the show. It's great to have you on. As you know, Valley Health holds a special place in my heart. It was a very formative time in my leadership career. Before we jump into the conversation, maybe we could talk a bit about your background.
Yeah, as you mentioned, I'm a recovering CPA. I had the opportunity to make the transition from CFO to CEO about 20 years ago. And that really is when I think I felt like I had found that thing that I wanted to do, leading people, trying to inspire them, trying to build teams. And so I'm a husband, a father, a grandfather. I've got kids all over the place. One in Hawaii, one in Seattle, and then one in Charlotte. And the one in Charlotte is actually a vice president with Atrium Advocate Health.
Well, there you go.
She's a master's prepared nurse. She's the one who, when she came to me and said, I like what you do for a living. What would you use as your jumping off point to do that? And I didn't hesitate. I said, I would be a nurse. And because nursing really gives you an established credential, if you will, as a clinician, and it helps you lead.
Let's jump into some questions for you. So as you think about leadership, let's start with this. What do you see as the most important qualities for a leader?
I think there's so many, but the thing that feel is most important is what we term a connection to purpose. When I got here, there was a need for cultural transformation, and I came out of Catholic healthcare, faith-based care, which really helped me establish what I call connection to purpose. It's the idea that this work is a calling, and that if you are connected to the purpose of the organization and the mission of the organization align with your own, it doesn't feel anywhere near as much as work than it does when you're trying to force your values and your mission to fit into something else. So I think this idea of connection to purpose and driven to excellence is what everybody around here talks about. And I think that the key qualities that a leader has to have, first and foremost, is authenticity. Do you really believe what it is you're saying? Do you really believe in the direction you're setting? And can people tell that? Because there's nobody that can see through an inauthentic leader like frontline healthcare employees.
Yeah, you can't fool them.
They know if you believe what you're saying.
Yep.
They know that that you really do believe authentically what it is that you're talking about. When I got here, I took this job on March the 6th, 2020. Yeah. And so, everybody knows what was happening on March 6th, 2020. The world was getting ready to end. And having to come in and try to convince a group of people that you really did believe in what it was you were talking about, trying to do that with videos, with a mask on, and, from Zoom calls and all that. So I think really that if I had one quality that I really want to make sure that people know, it's authentic. Are you an authentic ministry leader? And do you walk the talk? And are your actions consistent with what you're saying?
Yeah,
Because
no
that
doubt.
builds trust.
Yep.
And I think that there's a lack of trust on the part of most people in America about any institution. And so if you're authentic and you show up the same way every day, I think that people begin to recognize that, they start matching up your actions with what you said. And as those become more and more consistent, it kind of builds that social contract with those that you're fortunate enough to lead. So I would say authenticity would be the number one thing that I think a leader needs to have to be effective.
Yeah, I think that's really well said. Certainly, if you're authentic, if you're living what you say you're going to do, that's, as you said, often missing in leadership. We say one thing from the top and then we do something else. And that's where trust is really breached and credibility is lost. But I love where you started, which was connection to purpose. And because if you really believe in what you're doing, if you understand the why behind why you get up every day, it makes the harder times a lot more palatable, and it gives you the ability to get through them a little easier because you know there's a bigger purpose to what you're doing and why you're doing it. Talk about inspiration and impact in leadership. You can take it wherever you want to go here in terms of the most inspiring leader in your life or the most impactful leader in your career. What would you like to share about that?
Yeah, I always tell people I've been the beneficiary of three extraordinary leaders in my career. And I would say that my style, my leadership is really a blending of those three individuals.
Hmm.
And they were wildly different. And the thing that the three of them taught me was there's not one personality type, there's not one philosophy that is the secret sauce. So you lead by what comes natural to you. But the first leader that I had, first CEO I worked for was a guy by the name of Harry Nurkin, and he was the CEO at what was then the Charlotte Mecklenburg Hospital Authority, which was a public hospital, a governmental hospital in Charlotte, North Carolina. And I got to watch him lead. And what he really taught me was how to make people feel what I feel. And I remember him distinct memories of, when we have the employee longevity awards, you have these dinners and you have all these people that have been there for 20, 30, 40 years. And I watched this very professional PhD trained leader as comfortable with the dietary staff as he was with the medical staff. He would just hug them and make them feel so valued. And so I've tried to make my leadership communication style in that way. If he wanted to tell you a sad story that would make you cry, you would cry. And if he wanted to make you inspired to run through a wall and do a hard thing, you would want to do that hard thing for him. So I would say my communication style and the way I interact with employees was mirrored what Harry did for years, and I had the chance to work for him for about 10 years, and it was just an awesome experience. And that led me to the next leader that I had, a guy by the name of Larry Hinsdale, who was CEO at Northeast Medical Center in Concord, North Carolina. And Larry was the first person that could criticize me at a rate I could tolerate. Because you're in your late 20s, early 30s, and you really don't do a lot of self-reflection.
Yeah.
And Larry's style, he was very reserved. He was not an extrovert. He was not an inspirational speaker, but he was very thoughtful and super smart guy. But he had the ability to give me constructive criticism in a way that didn't make me defensive. Um, and it made me want to be better. Larry told me, he said, "Look, the most valuable thing you can have is a mirror that you can look in and see a reflection of how other people see you." And, and what it made me realize was I'm pretty good, but I got a lot to learn about how to interact with people and how to be open to the idea that I'm not doing everything right. And so that helped me at a very pivotal point in my career when I was trying to be a CEO. I wasn't there yet, but that period of time helped me understand that you don't have it all figured out. You really do need to listen to those around you, and you need to be open to the idea that you can get better.
Yeah, we all have blind spots and we lack, I don't care who you are, how long you've been in leadership, you lack complete self awareness. You don't always know how you're landing on somebody else, how somebody else is taking in what you're trying to give out. And, we think we're communicating one thing and it's landing in a different way. So that feedback, that ability to get feedback, to grow our self-awareness, it makes us a much better leader, but it can be hard.
It is. And really learning how your words are falling on other people.
And it's also a time where you can get yourself in a lot of trouble because you don't know what you don't know yet. And to have a leader like that who is willing to create an environment where you could get feedback without becoming defensive, without sort of rebelling. Credit to you for taking the feedback, but it sounds like he created an environment where it was safe to get that feedback. And so,
Absolutely.
yeah, and so that's a good challenge to all of us as leaders is you're not doing anybody any favors by not giving honest feedback to leaders you're working with. And that's what really develops us in the long run. And I've seen that in my career where I've had leaders I've worked with that I haven't given the kind of feedback that probably they needed. And sometimes where I haven't taken the feedback that was trying to be given to me and thought I knew better. So just really great commentary from you and that relationship with Larry that really launched you into the next journey as a CEO.
It did. And then my final the last boss I had before I became, the person in charge, was a guy by the name of Rich Statuto, who was CEO at Bon Secours. Rich, um, Rich was the person who really kind of, invested in me to tell me that, yeah, you've got a lot of skills, but you need to improve what he called your ministry footprint. He said,
Mm,
you are good at all those things, but the people don't necessarily see you that way. And and so that was that idea of that I have a ministry footprint and I need to, very authentically care about the people
yeah,
that I'm taking care of, that have been
yeah,
entrusted to the organization, and I need to really care about my colleagues and coworkers, and the success of the team is far more important than the success of the individual. And so, as I've gotten longer in my career, I really do stress the mission to the people here. He taught me how to be a mission driven leader and to make that the focal point of my decision making. I got to be with them all for about 10 years each. And it really formed the leader that I try to be today.
yeah. And I'm sure as you look back on those three individuals, you try to give leadership guidance and advice to those that are working with you now because you can see the impact and the inspiration that you got. I do love that last vignette there of your leadership mentorship with around connection to purpose, around mission, around the things that really do matter, as well as to the people around you, the people on the team that really are doing the work with you, that we're not in leadership on our own, that we're in it. And healthcare is a great example of what it means to be part of a team. To serve a mission, you need a team to do it. So,
Yeah.
yeah.
And it's what I've found is that people don't realize they're missing that
Yeah.
until they see it.
Yeah.
And these younger generations, which, I'm super positive and optimistic about the people who are coming behind me, they've grown up in a different way than you and I have. And there's not as much social connectivity in the world in person. And what I've found is people look to their employer for a lot more than just the job. It's
Yeah.
community,
Yeah.
and it's a support structure, and it's purpose. And
Yeah.
almost everybody that I come in contact with really is looking for purpose in their work and meaningful work that makes a difference. And as a leader, if you can tease that out and reinforce that, you end up having a much more engaged workforce, and you have people that they don't want to leave the ministry because they feel like it's part of their community. And I think that's been something that's been very well received here at Valley Health. I attribute that to those three gentlemen, one who's passed away, the other two who I talk to on a weekly basis. Those relationships have endured, even though it was a boss employee relationship. They've endured into friendships and connections that I think will be with me until I'm gone.
Yeah. Well, and I love the idea that people want to be part of an organization that's connected to purpose. We do spend a lot of time at work. And so, as a leader, creating the environment, the culture that people feel good to be a part of and excited to be around, that goes a long way. Let's move to a conversation around transparency and vulnerability in leadership.
Growing up in leadership, it was I got to see a lot of traditional top-down leadership
Yeah. Yeah.
where, people got told what to do, but they didn't get told why.
Yeah.
And they didn't understand the why. And so I've tried to be what you see is what you get. And there are no real confidential secrets other than personnel matters. The reasons we're doing things, if we're doing them for the right reasons, we ought to be able to talk about. If you don't want to talk about why you're doing something, you might want to think about whether or not you should do it. Because if it doesn't make sense to the people you're leading and you can't transparently communicate it to them, then you might be on the wrong track. And so I've tried to make it a linchpin of my leadership style to share with my teammates, my employees, the why. And I think that if you can convince them that the reason you're doing it is mission driven, and yes, it's a hard decision. It might not be popular, but it's the right thing. When I first got here, I mentioned to you, I got here during the pandemic, and we were faced with the idea of should we make people get vaccines or should we not? And in rural Virginia, that was not exactly a popular thing to be talking about. But ultimately, we made the decision to tell people you had to get a vaccine because we have to protect the community.
Yeah.
If 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 1,000 of you are sick and I can't take care of 1,000 people that are coming in, I can't serve my community by improving health. And while that wasn't the most popular decision, it was very transparent. They saw it coming from miles away. And you know, again, you've got to make your decisions. You got to be able to share the why. So I think that transparency is very, very important. And I think,
Yeah,
go
it's a
ahead.
powerful way to align an organization, a team, because not everyone's going to agree with everything you do or every decision you make or every decision that the senior team makes. When people know why, when you take that time, that extra step to give the why, the rationale behind it, even if you don't agree, you can get behind it. You can say, all right, I get it. I understand it. Maybe that's not what I would do, but I understand why we're doing it. And that's often missing in organizations and leadership structures. Some great thoughts there.
Yeah, and then the other part of that is vulnerability. I'm a big fan of Brene Brown, who talks a lot about a leader needs to be vulnerable. And I think that a lot of leaders or think they have to have all the answers. And at the end of the day, I tell my employees all the time, "Hey, I've never done this before. I don't know. I don't have a roadmap that this is going to work out perfect." But to let people know that you're human and that sometimes, yeah, I don't know if this is exactly right, but I think it is, and here's why. I think that people relate to someone who shows their own vulnerabilities and they understand that you're not just born a CEO. And you don't get the title and all of a sudden have all the answers. And I think people appreciate that those times when you actually show your vulnerability. I tell stories. Well, history was created by people telling stories. They tell the stories that are meaningful to them, that mattered, that are a reflection of the times. And I tell people, stories all the time to, help them understand that I'm just a guy. I mean, my dad was a mailman. I was not born into CEO, royalty. It's just we all are gonna find times when we don't know what to do, and we aren't certain of what we're doing, but we gotta be comfortable taking the risk. We gotta be comfortable sharing people with people that, yeah, I'm vulnerable, but, that to me is something that that a leader who is always sure of everything is not being honest with himself or those he's leading or she's leading.
Yeah. And the people around you know that. When you surround yourself with smart people like you have in healthcare, like you have at your organization, your vulnerability brings out the best in everyone else around you as well. Because you create a safe place, a place where it's okay to say you don't know or what do you think or how do we go forward from here? And that's not A lot of leaders would say, well, that's demonstrating weakness, but I think that's actually demonstrating a powerful leadership example that makes people really want to follow and be a part of the direction that you're going. All right. As we wrap up here, maybe a concluding thought that you'd like to leave with the audience.
I would go back to, a couple things. One is be your authentic self. I mean, be who you are because everybody else can see through it if you've been trying to be something you're not. I think that's really, really important. I think that culture matters more than anything, and that if you can get people, we call it called to serve. Every year we have, for all leaders, we have a half day session that we call called to serve. And it reminds people every year that this is not just a job. This is a greater calling, and you need to think about that and reconnect to that at least on an annual basis. I try to do it most every day, but that connection to purpose and you are authentic in your belief, then you can be effective. And I would tell you that that part of it is more important than your education and your pedigree and whether or not you can differentiate a calculus equation. What matters is, do you believe in what you're doing? Are you authentic about it? And can you convince others to go along with you? Is probably the number one thing I would leave with people. Um, and make sure that you put the needs of others above your own, because that's really what comes down to, particularly in healthcare. People come to us at their time of greatest need, often elderly, often frail, often scared, and they look to us to make it better, both from a clinical perspective, but they also look to us to give them compassion and empathy and make them feel valued, and at all times making sure that they get to keep their dignity. And that's something that, you can make somebody well, but if you make them feel like they've lost their dignity or that they don't matter, it doesn't matter as much that you made them well.
Yeah.
It's how you made them feel.
Yeah.
So, yeah, could talk all day about leadership, but
Yeah.
those
Good
are
stuff.
probably a couple thoughts I'd leave you with.
I appreciate it. And, the idea there that you said putting others first as a leader, I mean, that's the definition of servanthood. And, as leaders in healthcare in particular, we're called to serve a community, serve a patient population, frankly, serve our team and the people that work with us. And so really well said, Mark. And obviously you're making a significant impact there at Valley Health as you live out these leadership principles. And congrats on your 6 years with Valley Health. And thanks for coming on with me today. I appreciate it.
Thank you, Al.
All righty. Thanks for listening. Leadership is rarely simple and it's rarely easy. And that's exactly why it matters. My hope is that something from today's conversation gave you a moment to pause, reflect, or see your leadership in a new way. Until next time, lead well.